Hello, everyone. Welcome to this session called A Clash of Contagions, COVID-19 Conflict and Humanitarian Response. This session is based on a report that Mercy Corps released earlier this year, and a link to the report is in the session description you'll see in Whova. The bios of the speakers are also in Whova and linked, and I encourage you to view all of their bios of these accomplished speakers. I'm very honored that they're all joining us here, the colleagues from Mercy Corps. I'll turn it over to Dina to kick us off for the conversation.
Thanks, Kristen, and hi, everyone, and welcome to this Goalmakers session hosted by Mercy Corps. We're going to be talking to you, as Kristen said, about some of our research and on-the-ground experience relating to COVID-19 and the conflict dynamics in some of the places where we work. My name is Dina Esposito. I'm a vice president here at Mercy Corps, and my job this morning is to welcome you, tell you a little bit about us as an organization to set the stage for this deeper dive discussion. For those of you who don't know Mercy Corps, we are a global international organization with headquarters in Portland. We have about 5,000 staff around the world and work in some 40 countries, and we prioritize work in extremely fragile or conflict-affected places. So think places like Syria, Yemen, and Iraq in the Middle East, in Africa, Somalia, South Sudan, and Ethiopia, and in this region of the world, Colombia, Haiti, and Guatemala, to name a few. Some 95% of the staff in Mercy Corps are from the countries where we work, and we help communities get through crises, first by providing life-saving aid, including access to food and water when it's needed. We're also working to address root causes of poverty and some of the grievances that drive conflict. Through our economic development programs, we're helping to build people's capacities, we're helping to build market systems, and we're helping to grow incomes. And alongside this relief work and this development work, Mercy Corps is also involved in peace-building programs where we're helping to reinforce skills and structures in communities that help people solve conflicts peacefully. And we believe that this work across these areas of relief, development, and peace-building are urgently needed simultaneously to improve lives in these fragile places. And we consider this something of a Mercy Corps distinctive, that we're trying to bring these threads of work together. Like all of you, because of COVID, we have had to try new things as an organization, learn and adapt to achieve our mission, which is to build more secure, productive, and just communities. And while COVID has presented some really tough hardships, some of the organizational changes it has hastened is actually very good. It certainly has hastened the elevation of national staff into some of our leadership roles. It's reduced our carbon footprint, while also providing remote support to countries that offers room for greater diversity of voices and ideas to bubble up. Our staff have been able to keep roughly 90% of our global operations going, and they've adopted new COVID protocols to keep themselves and the communities we work in safe. And some of the COVID work that we're doing includes mobilizing grassroots efforts to counter COVID-19 and misinformation to build people's confidence in getting the vaccines in places like Haiti and Guatemala. We're also working to increase access to clean water and hygiene kits, which are so vital to reduce disease transmission. From refugee camps in Syria to displaced communities in Iraq and northern Nigeria, all told, we reached some 13 million people last year with such support. We're also focusing extensively on mitigating the impacts, the food security impacts of COVID-19, which has severely impacted or severely exacerbated a growing global hunger crisis. So around the world, we've supported roughly 5 million people with cash transfers and food vouchers, which help them access food, medicine, and other vital needs of their families with dignity and choice, while also supporting the local markets and local economy. To speed recovery, we're working not just with households, but also with businesses, and we're providing grants to small businesses in countries overseas, as well as right here at home in Portland, so that they can keep their doors open. And always our efforts are really trying to focus in on women and youth who are not only in need of specialized support, but also serve as really powerful and unique change agents in the families and in the communities where they live. On the program side, all told, last year, we reached about 50 million people around the world, and our COVID responses alone reached about 30 million. And as this session is focused on conflict, a final word here about peace building. Mercy Corps is implementing some 50 conflict mitigation and peace building programs in 20 countries. And we have a very strong in-house research team that has been able to build on this large program platform to study what works, how can we help communities prevent violent conflict. In Somalia, for example, our team was able to measure the impact of our youth engagement programs and saw a 65% drop in support for political violence among program participants. So our conflict research is very much informing this point of view that I started with, that when we combine humanitarian development and peace building efforts, we believe that over a sustained period of time, we can decrease the support for violent conflict and build stronger, more prosperous, and more secure communities. So now it's time for you to hear about this recent report, The Clash of Contagions. I'd like to turn it over to one of our social scientists extraordinaire, Maisha Alam. She's going to be sharing some report highlights and recommendations and then moderating a panel with some of our team leaders from Colombia and Liberia. Maisha, over to you.
Thank you, Dina, and thank you to Global Washington for bringing us together. I'm delighted to have this opportunity to share with all of you a little more about our Clash of Contagions report. You know, one of our initial motivations for this study was an observation that only counting incidents of violence really provides an incomplete picture of conflict. And in contrast, our goal in this report was to understand communities' perceptions, their experiences, and their aspirations by drawing on in-depth interviews and participatory workshops that we conducted with more than 600 men and women across Afghanistan, Colombia, and Nigeria in the first quarter of 2021. So what did we find? Well, across our 3 case study countries, we found that the pandemic and response measures are exacerbating underlying drivers of conflict through 3 primary pathways. First, by diminishing trust in government leaders and institutions. Second, by increasing economic hardship and resource scarcity. And third, by disrupting, and in many cases indeed eroding, social cohesion both between and within communities. And a common thread throughout these pathways is that governments have struggled generally to provide services, maintain a presence in contested geographic areas, and to help communities deal with the far-reaching health, economic, and social consequences of the pandemic. As governments have seen their capacity and their legitimacy strained throughout the course of the pandemic, we've also seen a variety of different types of armed groups, including, for example, insurgents, criminal networks, and banditry gangs, capitalize on the conditions created by the pandemic to essentially expand their spheres of influence. So based on what we learned in this report, which I encourage you to take a look at in more detail, we offer a set of key recommendations for donors, policymakers, and practitioners in both the public and private sectors. First, it's critical to ensure a conflict-sensitive approach to all COVID relief and recovery efforts. This requires moving away from a reactive approach to conflict, one that primarily focuses on treating its symptoms, such as violence, towards a preventive approach to conflict, one which prioritizes peace building and focuses on root causes. And the bipartisan US Global Fragility Act, for example, is a key tool in this respect. And its full implementation over the course of the coming decade must be done in a way that takes into account how the pandemic has exacerbated underlying drivers of conflict. Relatedly, we call on policymakers and practitioners and donor agencies to consult and engage directly with communities in order to ensure that policies and programs reflect the ground realities that communities are experiencing. This is indeed critical to the broader localization effort that is happening in this sector. And it's also key for ensuring effectiveness and inclusivity of pandemic relief and recovery efforts in fragile settings. For example, as Dina was alluding to support the sustainable recovery of livelihoods that have been disrupted and oftentimes devastated by COVID-19 response measures. And finally, COVID-19 has eroded hard-fought development gains and left communities in precarious conditions, which is particularly concerning when we realize that at the outset of the pandemic, armed conflicts were at their highest level in 30 years. Now, to correct course, we recommend that conflict prevention and peace-building approaches be adapted to anticipate, track, and indeed address various types of conflict. For example, intercommunal conflict, anti-government insurgency, pastoralist conflicts, and conflicts over illicit economic activities, as well as the associated risks to different segments of population, such as women who are particularly susceptible to domestic violence, which has really worsened during the pandemic, or youth who are particularly vulnerable to recruitment by non-state armed groups, which with recent evidence suggesting that the pandemic is contributing to the emergence of a new generation of child soldiers. And the findings and implications of this research extend beyond these three case studies. They're relevant to a wide range of stakeholders, from bilateral donors to philanthropic foundations that are making critical investments to support pandemic relief and recovery, to corporations that are trying to expand opportunities in emerging markets while navigating risk and uncertainty. And Mercy Corps is proud to be a global organization that's working directly with communities on the ground to advance our mission, while also serving as a thought partner for public and private sector leaders. So I'm delighted now to be joined by my colleagues Niji Park, Mercy Corps' country director in Liberia, and Jennifer Dom, Mercy Corps' director of programs in Colombia, to delve a little bit deeper into how COVID-19 has impacted instability in these two countries and how we've redoubled our efforts to alleviate economic hardship and mitigate conflict risks during the pandemic. Jen, let me start with you first. Can you briefly describe how you've seen the pandemic and response measures affect conflict dynamics in the regions where Mercy Corps works in Colombia? And what are some of the things you've done to try to address those dynamics? Thanks.
Sure. Thanks, Maisha. Greetings from Bogota, where I have been happily living for the last 8 years. First, I'll give you a little bit of background about Mercy Corps in Colombia. We've been operating for 16 years now, and we have worked during that time in a total of half of Colombia's departments. Right now, we have 5 field offices. So in Tibu municipality and in Cauca department, where we mostly have funding through the Howard Buffett Foundation, our team is carrying out land formalization for rural farms. In Cauca, we are incentivizing coca substitution by providing on-farm technical assistance, as well as entrepreneurship activities to improve income generating options with a focus on rural youth. We also work in the urban areas of Medellin, Cartagena, and Valledupar, and their sort of surrounding municipalities, where we are supporting Venezuelan refugees and Colombian host community members. Our programs for them include emergency cash assistance, protection, livelihoods, and healthcare activities, which is all supported by US government funding. And in Cartagena, we're piloting a program for Colombian and Venezuelan youth, thanks to the Hilton Foundation, with a focus on youth-led initiatives to provide them with skills for entrepreneurship and employability. So in terms of exacerbating conflict dynamics, the pandemic and its response measures, they've been devastating. We had a prolonged national lockdown from March until September, which dramatically limited state presence in many areas. It delayed peace process programs. It limited the ability to request state support for human rights violations, for displacements, for people under conflict. And also the armed actors didn't respect the quarantine. So the armed actors didn't stop working and took advantage of the lockdown to expand their presence and to keep working with less government interference and with less other interference. When you were talking about the economic devastation, to give you a sense of scale of that in our programming, in our emergency cash program, we saw that overnight, program participants went from reporting that our contribution to their monthly household income was about half to 94% saying that it was all of their household income for the month. That was because they were confined to their homes and they didn't have any other options. In the areas covered by the report, we have been responding to these dynamics by doubling down on our community acceptance strategy, which is so key to success of working in these areas. So just last week, I was with our Tibu team, and they were telling me about how in early 2020, when they first started working, they planned socialization after socialization to go out to the communities and tell them about the program. And in the beginning, they had various times where nobody showed up, or maybe 1 or 2 people showed up, but they kept at it. And and now we have hit our limit for the number of people we can have in the program, because they knew from our experience in Cauca, where we've been working for a lot longer, that it was just part of the process, and that communities were very understandably reticent to receive us and to trust us. They've had a lot of experiences where agencies arrived saying that they were going to provide some type of support, and ultimately they were left disappointed. I was in Cauca recently and heard over and over again from our program participants that we're cumplidos, which is the Spanish way to say that, like, we do what we say we're going to do. We do what we say we're going to do. We were back doing in-person activities with some like very extreme biosecurity measures. I mean, the full suits, the like spraying your shoes with alcohol, the whole thing, as early as June 2020, even though the lockdown didn't partially end until September, so we had to get a humanitarian exemption in order to continue doing our activities. But we really wanted to get back out there. We wanted to show the communities that we were ready to work, that we were committed, that we hadn't just left. And in exchange, we've been able to maintain our presence, even in areas where there are like up to 4 or 5 armed groups sort of vying for control. We know how important it is to keep working, to showing the communities that we care, that we don't take their trust for granted. But we are living with the reality that these armed groups are growing stronger and stronger. We have had to adapt our work plans. We've had to move slower in some cases than what we were hoping. And we are relying heavily on our trusted community leaders to make sure that our teams are safe and secure, and that we can keep programming in these complex locations. Through these efforts, though, we've been able to establish ourselves. We're a stabilizing force in these communities facing these extreme challenges. In Cauca, we are offering people a way to get out of the coca business, to get out of the drug business and all of the associated risks, and provide them with technical assistance so that they can improve their production on their farms, so that they don't actually lose income by substituting their coca. In both places, in Tibu and in Cauca, we help them formalize their land so that they have assets to leave for their children. And it's really hard, but we feel good knowing that we are contributing to a peaceful future for Colombia.
Thanks so much, Jen, and for really kind of helping us understand what the on the ground reality looks like. Miji, I know that your team has also conducted some really interesting survey-based research and recently published an analysis on the pandemic's impacts on a range of socioeconomic and political factors. So can you tell us a little bit about how the pandemic and response measures have impacted conflict risks and instability and community level social cohesion in Liberia?
Great, thanks so much, Maisha. Good evening from Monrovia in Liberia. Maybe just a quick brief. I don't know how well known Liberia is. So we're a small country in West Africa, population of roughly 5 million people. We're still in recovery from what I would call a triple crisis. So decades of civil war from 1989 to 2003, Ebola back in the 2010s, and now, of course, COVID. Over half of the population here is living below the poverty line, so there's very limited resources to deal with these sorts of crises. As we are exiting the third wave of COVID back in August, we're also completing this COVID secondary impact study. We found some very real household level impacts, as you might expect. So 60% of the household respondents said that at least once a week they were unable to eat. 89% experience a reduction in purchasing power, and there is little backup plan in Liberia. So, over 90% don't have savings, and over half had to go into some sort of debt to deal with this situation. We also found some interesting, more community level conflict, governance, and social cohesion findings. So we can start with the positive. 90% of households trusted government the most to provide accurate information about COVID. And most knew about these various relief and recovery initiatives, which is great, but they were disappointed in how these initiatives were rolled out. So the perception of unequal distribution of these sorts of stimulus packages, and of course, there is limited functionality of government due to these lockdown measures. As we here in Liberia enter the election season, which should be in the last half of 2023, hopefully, over 40% were looking ahead and really thought that COVID could negatively impact elections, mainly around social distancing measures, either leading to limiting campaigning, or even social distancing leading to instances of fraud. Another very concerning finding that was referenced earlier, but 2/3 reported an increase in violence and harassment. And this was mainly in the home due to stay-at-home measures and loss of income. And worryingly, over 3/4 actually mentioned some of these unaddressed conflict factors that caused and maintained the civil war. So corruption, impunity, arbitrary killing of innocent people, land disputes. So from the study, it's clear that COVID really stressed existing societal divisions, and these are the same unresolved triggers that continue to act as potential creators of conflict today. Liberia still has not implemented key aspects of recommendations from a Truth and Reconciliation Commission, fully enacting a war crimes court, pushing forward criminal action. Corruption is continually called out, and individuals involved in corruption and conflict are still in positions of power. And we all know that governance really requires trust. There was a call out to civil society in the study around advocacy and accountability. Government responsibility really goes beyond COVID, of course, but to basic delivery of services, budgeting and planning procedures. That's not yet happening here. Yet international and national civil society are implementing programs in this space, but it's just not fully visible to the community. In addition, we have to deal with the challenge here of the reducing enabling space for civil society, which does mean we need to tread carefully leading up to this next election. However, even within all these concerns from the COVID study, there were instances of communities coming together. So we saw a lot of voices saying that Muslim and Christian representatives noted greater collaboration across religions. So religious leaders really working together to provide social services and relief to communities, especially during times where government was unable to do so. So it's this togetherness that also defined the COVID times in Liberia.
You know, listening to both you, Miji, and Jen speak about the experiences, I'm really struck by how, despite being very different contexts, there are these similar dynamics across these two countries. And you're both reiterating something that I think comes through in the report as well, which is that these are very complex issues that cannot be reduced to a single statistic or a soundbite. So from your vantage points, I'm curious, what are some locally relevant steps that need to be taken in Liberia and in Colombia to prevent new or worsening conflicts and to build inclusive peace as part of the broader pandemic recovery process? Are there any key recommendations you would make to, the private, public, and civil society stakeholders? Maybe Miji, I'll go to you this time first.
Sounds good. Thanks, Maisha. No, I think a number of things really come to mind with that question. So for us, building on momentum of Mercy Corps and other actors' current programming around civil society support, so strengthening leadership of civil society and capacity as well. So for example, our current civil society program is building the strategic resilience of 26 civil society organizations. So just for example, together we've developed a national civil society response to a recently passed NGO policy, which points to that shrinking enabling space for civil society, and education policy focused on retention of girls in school. Another major topic here in Liberia is decentralization of government. So it's really the basics. So having budgets and work plans at a county or district level, legislation at a county level. Communities really don't have the opportunity to have an amplified voice in a decentralized government unless they're well organized. So in this space, Mercy Corps has a catalyzed approach, which really guides our community mobilization. And this enables us to build on traditional village and paramount chief systems that exist in Liberia. So there are a few steps as part of that process, really ensuring representative leadership, being inclusive of vulnerable groups like women and youth, voices that really capture a community. And then of course, establishing trust with those voices as well. So typically we support structuring of some sort of action group. For example, youth groups oriented around solving problems relevant for youth, or even COVID response committees that provide humanitarian support to families that were affected by COVID. There's usually some sort of training on advocacy, things like interest-based negotiation, or other topics of interest to the action groups. And then we go through this process of assessing and prioritizing needs. You can hone in on specific topics, environmental concerns like land degradation, or also generally, and then develop an action plan. So developing those solutions together. And usually Mercy Corps would seed a few impact projects so the community can test out their voice and their solutions as well. So at the end of this cycle, these organized structures can be connected to government representatives so that they can continue to prioritize issues, develop solutions, suggest them to government stakeholders over the long term as well. So this catalyzed approach has demonstrated improvements in community cohesion and social capital. And these are the same resilience capacities that really enable households and communities to deal with future shocks and stresses. You might ask, where's the private sector? I'll be honest and say Liberia right now does not quite have the right enabling environment for a vibrant private sector. Corruption, again, is a persistent challenge for any business looking to grow. The government has policies in place to increase competitiveness for Liberian-owned businesses, but these are challenged because of corruption. So you have government officials who frequently get payouts from foreign-owned businesses, so obviously they have a negative incentive to enforce these policies. So I would say we have not yet fully tested the private sector capacity to demand the right enabling environment from government. But they are a major contributor of revenue for the government. There is a promising new but small generation of Liberian young entrepreneurs who are really fighting a tough battle against poor infrastructure, lack of business development supports, no financial services, to still come up with new and often tech-oriented ideas. So Mercy Corps is spearheading initiatives to support entrepreneurs in a more market-driven model. So we're working to strengthen market actors to deliver better services to Liberians. For example, working with microfinance institutions to develop tailored products for youth, working with government investment bodies to build the right market infrastructure to enable trade. For example, Liberian roads are impassable for large parts of the year because of the rainy season. And there's no electrical grid outside of the capital city of Monrovia. Last example, working with solar energy companies to strengthen last mile distribution through a network of rural sales agents in more of a micro franchising type model. So these are not simple problems. They really require complex solutions. And we're hearing from fellow development actors that they're tired of investing only in government reform. Hasn't really worked yet. Instead, let's invest in the reformers and the catalysts who will be the future leaders of Liberia.
Thanks so much, Meiji. And, to move to Colombia, Jen, this is a country with an incredibly robust civil society and incredibly vibrant private sector, and that's quite well developed. So, yeah, can you tell us a little bit more about kind of what your recommendations and solutions that you've seen work are?
Sure. Thank you both. So a couple things to remember about Colombia are that after signing the peace agreement with the FARC 5 years ago, we knew that the other armed actors would be vying for the control in these areas where the FARC formerly had control. And we also knew that the government had a very short period of time to strengthen their presence and prevent the situation we're living in now. For many reasons, that didn't happen. And one of them is that Colombia began receiving Venezuelan refugees and had to dedicate substantial resources to dealing with that crisis. We think we have about 2.4 million Venezuelans here now who've all arrived in the last few years. And I think we're trying to welcome them and help them integrate into their new communities. And then COVID hit. So that, it's been rough. Like, I'm so grateful for the international support that Colombia has received, but I would say that it has simply not been sufficient. Of course, it's really difficult to decide where to put limited resources, and I am biased sitting here in Bogota, but Colombia has remained open to refugees, and in this extraordinary measure of goodwill is offering a 10-year temporary protected status for Venezuelans that provides access to education, healthcare, the right to work, and overall has really shown that it's committed to keeping its doors open. In Colombia, I've appreciated donor flexibility to respond to quickly changing circumstances, whether it was changing our work plan through Buffett or funding from the Department of State's Bureau of Population, Refugees, and Migration, where they recently approved us to expand our health services component that we have in Medellin, supporting Venezuelans, to another part of the department where transcontinental migrants, mostly Haitians with some Cubans and Africans from various countries, are arriving before they try and cross the Darien Gap into Panama with the intention to make it to the US. So the flexibility and the ability to adapt to these rapidly changing contexts has been critical. As far as the private sector goes, our experience has been mutually beneficial, and we're excited to build on those connections. We're currently working with businesses that are committed to hiring Venezuelans, like flower growers outside of Medellin, who export their flowers for these types of like high rotation entry-level positions where they want to hire Venezuelans. And it's been really satisfying. Through our Hilton program, we're doing something similar with a focus on youth. And our land program, working through cooperatives like the coffee cooperative Coffee Cauca, which buys coffee from, I think, like 60,000 farmers in Cauca, has had great success connecting farmers to national and international buyers. We provide like this on-farm technical assistance and the ability to transform some of their products so that farmers can dedicate a portion of their land to producing specialty coffee, to transforming their coffee, both of which command a higher price. We work with Grow, which is an organic fair trade buyer who purchases their coffee from 50 Amigas, a women's cooperative that we've supported. They actually were just on Shark Tank Colombia and got a $50,000 investment, which is very exciting. So that's just some of what we do, and we know that there's a lot of room for growth in that space. Finally, I just wanted to mention that, you know, as humanitarian and development actors, like we've all been talking a lot about localization, about decentralization of power. To the people best positioned to understand the context and those best positioned to respond. And Colombia has a lot of inequality. There's a vast urban-rural divide. I was actually thinking when Miji was speaking about how in a lot of ways rural Colombians face a lot of the same challenges in terms of energy access, road access that rural Colombia, they face the same challenges, Liberians and Colombians. And then on top of that, we face an almost unimaginable number of challenges in the last few years. But the government and people have high capacity. There is this amazing civil society, like well-developed civil society. In the last year, youth have been really advocating for themselves forcefully. And it's a really great place for international actors to let Colombians and Venezuelans lead the response. We have some great examples of that. We have a few local partners like Coffee Cauca, who I just mentioned. We have LGBTI-focused Caribe Afirmativo and legal rights-focused Opción Legal. I mean, they're absolute superstars, and they are going to be leading the responses to future challenges. And we are just here to support them and elevate their voices and provide them with more opportunities for growth. Thanks, Maisha.
That's awesome. And thank you so much for laying out both the challenges and opportunities. And before I hand it back to Dina, you know, we're approaching the start of a new year, and maybe I'll just ask Jen and Miji, both of you, just very quickly, if you want to mention, you know, one thing that's kind of giving you hope as we're hopefully coming out of this pandemic. You know, what's one thing that's really inspiring you or giving you hope?
Right, sure. So I just spent a couple days last week with our teams from Cauca and Tibu. They definitely give me hope. I mean, their commitment is unparalleled. One of the activities we did was that we shared a photo from one of our favorite work moments this year. And one was a staff member on a horse, because it's the only way to reach the farm where she provides technical assistance. Her coworker shared it because he said it represented the entire team spirit. Like, they go where they need to go, no matter how hard it is to get there. I shared one of our team member, Franklin, going to a farm to ask the owner, Alejandro, to join our program. Alejandro was like pre-sold. He wanted to join our program. He wanted to substitute his coca because he had heard from his neighbors that we were doing great work and that we were following through on what we said, and that he could possibly get a land title to pass on to his 6 and 6-month-old children. And then finally, just last week, one of our participants in our land program, Mayerly Sanchez, she was given the honor of being one of 2 Rural Women of the Year in Spanish, of the year in Colombia, in the category of Women Creating Peace Through Legality, which it does sound better in Spanish. But anyway, there's a lot to be hopeful about. I'm excited to see what 2022 has to offer.
That's awesome. And Miji, what about you? What's giving you hope and inspiration?
Yeah, from my side, I'll definitely echo Jen. It's the conversation around localization. So I think there's a foundational aspect that's still a bit of a problematic term, but decolonizing aid. So especially here in Liberia, the legacy of American influence is real. So power dynamics are of course shifting, but there's still this legacy of the Americo-Liberian. So that the generations of former slaves who influenced really the early days of a formalized Liberia, that legacy is still felt today. So the idea of living in a country where this Americanness is both prized, but also there's a look towards the future. There's been decades of development that have somehow institutionalized power dynamics that need to be deconstructed over time. And it's that difficult entrenched process that I think has become Liberia-led. So there's a real and uncaptured desire of Liberians really to shift the conversation. So I'll acknowledge it can be difficult as an INGO and as an American, but I do believe in Mercy Corps' role as an enabler in this space. And we see this with the partnerships that we do have with civil society partners. So to really be, to engage in a future that's Liberian-led, with Liberian leadership at the helm of INGOs and national civil society outcompeting INGOs. So we're in step 12 of who knows how many steps, but that's the conversation that really gives me hope for this work.
Great. Thank you so much both for this discussion and for your leadership. And Dina, let me now hand it back to you.
Yeah, I think I have just a few minutes to close out the discussion. I just want to thank all three of you for your incredibly insightful remarks. And I'm inspired by what I've heard from you today. I haven't had a chance to visit Colombia and Liberia in a while, so delighted to get your updates and your insights, particularly on this issue of localization and decolonization. So I'm glad to hear what is inspiring you. I guess my takeaway, one of the big ones, of course, to state the obvious, is that COVID-19 is not just a health crisis. We're seeing, and you've described so eloquently, the social, political, economic impacts of it, from people, first of all, having a humanitarian crisis, needing something to eat, from needing a job. And I liked Jennifer's conversation about helping Venezuelans with a cash transfer, but also then looking at those sustainable livelihood solutions. And I think that speaks a lot to what we're trying to do when we integrate work. Or Miji talking about land ownership as a connection to peace. And us, trying to make those intentional connections and facilitating linkages that aren't always apparent or obvious if we stay in a stovepipe. So all in all, I also really liked the way you all elevated the role of civil society. Jennifer, you said a stabilizing force, both whether it be around the relief, development, or peace programming, but also the urgency of engaging with government and private sector, and in different ways, depending on the context. This is a very, very contextualized situation, but definitely taking away this need for novel partnerships, multidisciplinary integrated thinking, and expanded funding to reach not only the health impacts of COVID-19 globally, which are vital to keeping ourselves healthy, but also funding to understand and address the poverty backsliding, the social cohesion, peace building components that are also important for us in the United States as we look for a more peaceful, stable, and prosperous world. So those are a few of my closing reflections, and I want to just thank you again as panelists, and thank you Global Washington for hosting us for this hour, and back to you.